an important topic, but spirituality comes into it direct because in spirituality we don't employ differences. We try to see people for what they are, right? At the core, at the being. So some of the recommendations we talked about in this one was how can we educate ourselves about other people's beliefs, other people's practices, how they are okay, because all paths lead to the same thing. And open dialogue is does a lot. Sitting down, we did that in the hospital with several faiths. We sat down and talked about what they believe, what it is important for them, and how we can understand that. And active listening is the most important thing in this particular thing. And also, a lot of people don't listen when somebody else is talking. Okay, active listening is coming with the intention, I'm going to listen to these people. And also, we have to be very mindful of the language that we do. Some things that are good in one culture can be very offensive to other. And then, of course, we have to celebrate diversity by really performing so many festivals and all that, right? And of course, suppose the religious accommodations, we have to really support them. And then we have to provide a model for respect and inclusivity. As the head of my corporation, of a physician corporation, right, I have to show that to my staff, to my other colleagues that are working with me and all that. And that was easy for me because my practice of really looking at people at the uh, at the core, not at what the personality, ego, or culture is, but they're human beings, being level. Because that's a habit helped me a lot not to engage in any parochial activities at all. Not even in a suggestion or a site. I show that difference. That helped me a lot. Okay? So I really believe inclusivity is something natural if we don't have any conditioning in our mind with the differences, right? So what I was talking about all these few days on this really uh, living in a way that we are coming from our spirit, which is equal in all of us, which respects everybody. And that's not like a tall order, but actually we learn all these differences by our culture, by our education, by parents, and all that, right? Beyond that, we are really all are one. And once we, and kids don't have the differences, but later on they're bred into it by us, the parents or the society, right? That kind of thing I was talking about. Tiana, you want to come up and ask me any questions or any comments? So you can, if you want to. I'm also inviting people on the Wisdom app, and they may come up. Just started to fill in there. Otherwise, I'm happy to say my piece and happy to leave the room after a while. I don't mind expressing what I wanted to express. This will be recorded, replays will be available. And some people, different time zones, they see them later that I know because they reach me later on with some questions. Not right away, but later on. Okay. So I make this video for so many people that are out there that want to listen to this kind of talk. You see, we are seeing so many problems in the society because of the way we don't really give importance to the spirituality as a whole. So hi Bhaskar, welcome. So this is all kind of important to consider these things also, not when it is convenient for us, but before really troubles brew in our societies, our systems, our institutions. We see that quite often in the hospitals and clinics. We try to employ these kind of policies much before they become a problem. That helps us. But even then, there are also so much of discrimination, so much of exclusiveness, and then are not really giving all the benefits of that care and consideration that needs to be done. Okay, so that kind of thing we see in the hospitals also. That's why I kind of get up sometimes and really talk to these people and ask them if you can really understand these kind of things. See, as a healthcare facility, for us, it's very important to really have an atmosphere where people are really kind, compassionate, and caring and taking time and patience. Those are important in patient care, right? We cannot be flippant, we cannot be angry, we cannot be irritable, and that becomes very tough to provide humane, compassionate care to our patients. So this is very important for us how we are inside, not all the things that we get because of the being a doctors and all that, but how we feel inside truly with our human beings and patients. That's very important for me, for my staff too. When we really do that, lots of times it works out very well. Uh, this is a consideration that is not just needed, but it is imperative that we kind of maintain that kind of atmosphere in the clinic, in the hospital, in the society too. As it is, I don't think the illness oriented health systems are working very well. And also, access to the medical care is very poor because most of the black neighborhoods don't have good medical facilities or all services available, or they don't have the insurance to cover that. This is going on very much. So that's why employing this kind of thinking, employing this kind of atmosphere is very, very important for us in the hospital and the clinic, right? So that's why I always want to convey this spirituality by how we live, what we say, what we do, what we really employ, all the policies. So that's all really important for us. And I do talk like this with our staff and everybody too. And they want really uh, implementable, actionable policies. That's where these things come. And one of the things we tell them is some discrimination, somebody really did that to you, tell us right away so that we can really see what's going on with that. Okay. So that is what I wanted to tell about today. And any major discussion on this is not really needed. We don't want to be making it a big splash about this, but then understand the importance of really treating everybody equally, making them feel inclusive, and giving them the respect with which they will perform in dignity and also in relaxation, because they don't have to be afraid of anything, or really they may lose some chances, some of that is there lots of time, right? So the leader, if he does that, if he lives like that, if he exudes that kind of spiritual nature, that he is kind, considerate, compassionate, and really respects the people for what they are rather than what they want to be or what you want them to be. That kind of thing goes a long way to increase the productivity, to increase the morale, and to increase real good feeling to work at the place. Okay, that's also important these days, right? Apart from the dangers we have with COVID and other things, we also have this discrimination. It's very horrible to work at the places like that. Of course, the being counters that have taken over the medical practices and hospitals, they kind of really make us, do things that we don't want to do, and that's why we are so disgruntled or demoralized. That's something we want to work against these drug companies or insurance companies. We are always fighting them, but it is a losing cause lots of times. Because most of the patients give the authority for them, thinking that they will protect them, but actually they are making money on their condition that they don't miss it. But when we talk like that, they may consider we are being very controversial, but actually it is the truth. The patients also have to wise up and then really study the health contract they are signing, so that they are not going to be cheated when the real care comes. If they show you that they will charge you thousands of dollars for a helicopter picking you for the aid draw, that's really unfortunate, and that is what happens because of the contracts are written like that. Anyway, there are a number of things we can talk about in that vein if we go to that place. Okay. So for today, this is what I wanted to say: inclusiveness of the people, very important. Respecting them is very important. And for that, if you are a good soul, if you are good in your heart, good in your interior, that can come through to the people who are doing that. And this is something very simple thing, but to practice, you have to be humane. You have to really come down from all those money or statuses and all that. Okay, if you become a human being and provide the care with the heart, then that heartfulness itself encourages the inclusivity and also respect for the other person too. Hopefully that makes a way as we go further into our um, uh, future care as AI takes over, and lots of things AI is trying to help us with a lot of stuff that we do in the hospital that can leave some time for us to be more, spending time with the patient, being kind to them, and then listening to them and asking questions and then making sure that they are through the healthcare system properly. So many things we can do instead of spending on time documenting and all the clerical work they are making us do now. Okay, so that way I think AI is good for the healthcare because it can increase the cognitive component, but also it can leave the healthcare providers to be able to spend more time with the patients because they don't have to do so much of mundane drudgery work. I hope it goes that way. I would definitely try to use that. Even now, I can see a lot of AI is relieving me with a lot of duties, and I was able to focus on the interaction with a human being. That's what I'm focusing on, and that will continue probably. Maybe doctors won't be there as much as it used to be, but whoever wants to provide care for the patient, they can spend a lot more time with them because they can use the AI tools. So that's why I embraced AI as a whole, but it's still a tool for me. It's a technology. It's not everything. Most important thing is what we are inside. Protect that, nurture that, come through you in the workplace. That is living spirituality, bringing out the spiritual nature of yours outward without really influencing anybody or putting pressure or propaganda on them, but just presenting these qualities by living them in your life. That is my thing I was talking about, and hopefully that made some sense for somebody. Even if you're one person, that's good enough. Okay, so I will stop there for today because I don't have much else to talk about. If anybody wants to come up and talk anything else, you can come up. Otherwise, I'll be closing in a couple of minutes.